So robots, automation, AI. We just heard 8 teams talk about all of that. Now, there's clearly an undergrowth of innovation in Austin and in Texas and across the country and the world. Now let's take that and apply it to something very big. Very big is saying you got 5 years, you're going to have to build out an academic medical center for a city that doesn't have one. You want to integrate that with the larger UT Austin, as Steve just outlined. There is lots of opportunity to work with the greater community. Oh, and by the way, that's about 300 beds and 1.7 million square feet. Anybody want to guess how long it usually takes to build a new hospital? About 10 years. I'm going to try to do it in 5. It's been about 4 decades since the last time a public university who did not already have an academic medical center built one. That basically means that there is no template to follow. By the way, we don't want to follow the template from 1985. It's been a few years. So if you remember what in 1985 was like, no robot, not a whole lot of automation, and no AI at that point in time. AI is old, but not that old. So what does that look like to actually completely reimagine? What does an academic medical center look like over time? Well, you have to reinvent everything, at least if you have the courage to not just follow what other people have done. What's the biggest problem that most new construction hospitals have? They're obsolete before they open. Because you think about the typical construction time of 10 years, just go back in time. 10 years is a long time. These days, 10 years is an eternity. So how do you start thinking about it differently and reimagine what the future might look like? Well, you can't truly predict the future. That's not possible. But you can prepare for it. It just requires that you rethink the construction process itself, the way that the place is going to operate, and by the way, the people that are going to work there. So we talk about automation and robots. In most cases, healthcare institutions have the problem that they have a whole bunch of people that grew up in a different world. We don't have any people yet. So how do you reimagine the workforce before you even hire them? That's a fascinating problem. What are the actual roles and responsibilities going to be in 2030, 2035, and 2040? So how do you actually tell the story of that when it doesn't exist yet? You have to put yourself in a future backwards mindset. What's the difference between a future backwards mindset and a current forwards mindset? Well, most institutions try to make the world better by starting with where they are, and then they progress from there and make things better. Some of us, including myself and a few other people in this room, right, Jim? Standing right over there, trying to answer a different question. Dr. Korndorfer leads education for Dell Medical School. And working with him and others, we're trying to answer the question, well, what is education going to look like in 2040? What's research going to look like in 2040? What is care going to look like in 2040? Which kinds of people are going to work in our facility in 2040? It's a daunting task, isn't it? This is a burned ground, greenfield kind of opportunity. They don't happen too often in a lifetime. Are we tracking so far? All right, so what might it look like? Well, here are a few examples. Very likely, we're going to have individualized manufacturing of treatments at point of care. We've talked about all these things that we can do. Well, what if we're actually going to customize all those things at point of care? Compounding pharmacy has been around for a while, but start thinking about gene therapies. Those are individual. Start thinking about, I don't know, theranostics, which is individualized way of applying radioactive materials for treatment. That's been a thing in cancer for a long time. It will be coming for other diseases. Or what about robots? Not big ones, little ones, millimeter size, that will creepily crawly around on the surface of your body and maybe inside to do whatever they're programmed to do. The programming of those things are going to happen at point of care, like 15 minutes to an hour before you actually undergo the treatment. It's a little different. That's not how hospitals function today, is it? The obvious part is, well, we will use robots for logistics. Yeah, there are people using robots for logistics to move stuff around today, but how do you blend that with people, and how do you think through just something simple like, What's the timing going to be? Which things can I move at 2 a.m. in the morning versus which things do I actually have to move, like lunch, while there are people working and operating inside the facility? That's an operational challenge that you have to think through. What about the fact that healthcare, for as long as I can remember, as long as anyone actually can remember, has always been about do no harm? How do we deal with do no harm? The way we deal with do no harm is we standardize, because that's how you create safety and quality, isn't it? Yes? Until maybe it isn't. Because what I just talked about is the fact that variability in some cases actually delivers a better outcome. Not just operationally, but also from a clinical care perspective and certainly from a research perspective. So is it possible, applying modern technology, to actually embrace variability within reason and make variability your friend, not your enemy? I would like to think yes. If you have an intelligent environment that understands everything that's happening, you can do that. And perhaps the most profound question of all is, if you change the question around the building itself from what can the building do to support people to how does the building become part of the team? What can the building do as a care team member, as a researcher, as an educator? I'll tell you a lot when you start thinking through it. So how do you all become part of that? Engage us, but engage us with the problems we're trying to solve. The hard part about the journey we're on is we have a finite amount of time. We have a finite amount of funding, and we have to be very judicious in terms of exactly what big bets are we going to make. So find things that you are passionate about that fit our big bets, and that's where we're going to partner. And that was my 7 minutes.